Well, good afternoon, everyone. Good to see you all. How's the mini mic? Good? Okay, wonderful. Thank you. Well, good afternoon. Thanks for coming down when it's so hot. So I appreciate it. The air quality is not so great either, but it's good to see you all. Thank you for joining us today. We're here to celebrate the signing of two landmark pieces of legislation that will protect Oregonians' access to health and support healthcare providers in our state. This is a good day for Oregon. In the year since the Supreme Court decision overturning Roe v. Wade, a patchwork of abortion bans across the country has put people's lives in danger and caused disproportionate harm to individuals who have limited income or come from marginalized communities. It's important to know that Oregon is not immune from these attacks. Neighboring states are banning and criminalizing essential health care, threatening patients and providers, cutting off access to care in rural communities, and targeting access to life-saving health care for transgender and non-binary individuals. But here in Oregon, thanks to all of you, we're taking a stand. I'd like to thank particularly House Speaker Dan Rayfield, who can't be here today, but he took decisive action following the devastating Dobbs decision by establishing an urgent work group to address the changed legal landscape after Roe. He convened patients, providers, and advocates from across the state to propose policies grounded in the lived experiences of the people providing and receiving care. And from that, they came up ways to protect and expand reproductive and gender-affirming care in a post-Roe world. Many of the folks who were on that work group, you are here today, and thank you. I am truly grateful for your efforts from the beginning to this moment. Because thanks to your hard work, we are here today to celebrate the signing of House Bill 2002. Because as you know, this legislation clarifies the patient's right to reproductive health care and shields healthcare providers from the kind of criminal prosecution that we are seeing in far too many states across our country. House Bill 2002 clarifies and expands access to gender-affirming care by closing gaps in insurance coverage. And I want to be very clear. Gender-affirming care is healthcare, period, end of story. Because everyone in Oregon should be able to access the healthcare they need to lead healthy and authentic lives. I also want to thank the legislative leaders who stood firm in the face of the longest walkout in Oregon history to ensure Oregonians would still get these essential healthcare protections. I'm proud to stand here with you and say that together we have secured the most protective abortion policies in the country. But we're here for another bill as well. We're here today to celebrate legislation that is aimed at addressing the state's ongoing healthcare staffing crisis. House Bill 2697, the Hospital Safe Staffing Bill, would not have made it to my desk without true collaboration and compromise. And I want to thank everyone, all the stakeholders, for their efforts to bring this legislation forward. Thanks to this new law, Oregon will now have nurse-to-patient ratios for hospitals in law. This legislation will address staffing shortages caused by severe burnout and help providers deliver high-quality care to Oregonians in need. I sincerely applaud the union leadership, hospital leadership, advocate leadership for working together to find common ground and solve problems together. And that's what we have in House Bill 2697. Thank you. Because with the leadership and collaboration that we saw across the healthcare landscape this session, I'm confident that Oregon will continue to lead the way in this country in building a more equitable healthcare system that centers patients first and foremost, and supports the workers and providers who do the care. So thank you for being here. We have a number of wonderful speakers to provide more detail, and I'd like to hand over the mic to Glynis Flanagan. And I'm so appreciative to have our friends with us today. Glynis.
Good afternoon. My name is Glynis Flanagan, and I'm honored to be here today to celebrate the signing of House Bill 2002. I have been a clinician at Planned Parenthood, the Salem Health Center, for over 4 years, and I am deeply committed to providing accessible, expert, and inclusive healthcare that entrusts our patients to make the best decisions for themselves. Just over a year after the Dobbs decisions, 21 states across the country have banned or severely restricted abortion access. Many have criminalized reproductive health and gender affirming care providers, and the harassment of providers in health centers is skyrocketing across the country. I know the first-hand strength it takes to show up every day in the face of fear and uncertainty, and I know the immense barriers patients face in accessing safe and essential abortion care. That's why I am proud to live in a state where we work to ensure that reproductive health care providers are supported and protected, and that no patient needs to fear being criminalized for making decisions about their own bodies. HB 2002 ensures that providers won't face action from neighboring states that seek to criminalize abortion, and that every person can make their own reproductive health care decisions and get the care that they need, no matter what. I applaud the governor's decision to sign HB 2002 into law, and I want to thank you all for your continued support. Thank you. Thank you. You're going to hear from Seth Johnstone from Basic Rights of Oregon.
Thank you all. I'm Seth Johnstone, and I'm the Transgender Justice Program Manager at Basic Rights Oregon. And today we're celebrating what the signing of the Reproductive Health Access to Care Act will mean for Oregon's transgender communities. At Basic Rights Oregon, we consistently hear from patients and family members whose children and families cannot access the care that their doctors prescribe as medically necessary. Adults have called my office for almost a decade since we initially established coverage here because their insurance doesn't cover specific procedures, or there were initial coverage procedures that were left out of coverage protections. This new law means that thousands of trans Oregonians can finally access the care that they need. It will ensure that our medical providers' ability to care for trans patients won't be compromised by harmful directions and decisions made in other states. We are moving forward here in Oregon. In a year when too many state governments are purposely making life worse for their trans residents, we are heartened to see Oregon continue to lead the way for LGBTQ+ equality. Thank you to Speaker Rayfield for including the gender affirming care component of their work group, to Senate President Wagner for his leadership, to Senator Lieber and Senator Manning, and Rep. Nose and Valderrama for being our lead sponsors, to Evelyn Kosher as well for being a strong community leader, and to partners Planned Parenthood and ACLU on the bill, and for the Oregon legislature and the legislators who fought to pass this law, and to Governor Kotek for proudly signing it. Today, we can say with confidence that trans people belong in Oregon. Thank you.
Good afternoon. My name is Becky Holtberg, and I'm the president and CEO of the Oregon Association of Hospitals and Health Systems. Today, we are here to celebrate the signing of legislation that gives healthcare workers a stronger voice, empowers staff with local decision-making, and reduces a significant source of administrative burden for hospitals at a time when it is critical that our resources be devoted to patient care. As a representative of Oregon's 62 community hospitals, I am proud to be here today to recognize the collaborative efforts that brought us to this day, and that I hope will continue as we move forward. When the COVID-19 pandemic started, few of us could have imagined the profound and lasting impacts that it would have on our healthcare system. Like an earthquake, it destabilized our workforce, heightening staffing problems that predated the pandemic. This put in motion a cascade of challenges for hospitals in delivering care, including a bed capacity crisis that persists to this day and continues to threaten access to patient care in some communities. Heading into this legislative session, it was critical that we act with urgency to preserve and protect access to care, to support and grow our workforce, and to stabilize the state's healthcare system. The foundation of that work started with addressing a nurse staffing law that didn't work for staff, for hospitals, or for patients. Our journey toward this legislation has been a productive one, characterized by a shared commitment to patient care and a shared vision for a stronger healthcare system. Through countless conversations and negotiations, we have found common ground in legislation that represents an investment in our future. We must live up to the agreements that we've reached now and in the future for this legislation to succeed. And as we celebrate today, we should remember that this achievement was only possible through open dialogue, compromise, and a commitment to positive change. Our joint effort serves as an example of what can be achieved when we act with goodwill and come together for a common purpose. Implementation of House Bill 2697 will require an ongoing commitment to the agreements we've made to ensure that it benefits staff and helps hospitals as they care for patients. We look forward to that work and to leaning into our collective strengths to shape a brighter and healthier future for all Oregon communities. And today, I want to give a special thank you to the coalition partners who are here and to the representatives of those organizations who sat at the table and did the really hard work with the support of legislators to make this happen. And I have the pleasure of introducing Erin Green from McKinsey-Willamette.
My name's Erin Green. I'm a CNA 2 at a hospital in Springfield, McKinsey-Willamette. I proudly serve on the Oregon State Board of Nursing as the president-elect, as well as on the SEIU Local 49 Executive Board. Like many healthcare workers, I have worked through some of the toughest conditions, including COVID-19, the pandemic, chronic short staffing, and I am proud to live in one of the first states where we are recommitting to making our hospitals a place that can provide the best possible care for our patients as well as our staff and better working conditions. House Bill 2697 will build on our current existing staffing laws in important ways that will affect the entire care team, from our EVS workers who didn't have a voice to our CNAs and our professional technicians, technical workers who will take part in the decision-making process and adopt staffing plans for all the departments. The new CNA patient limits will also ensure that your loved ones receive the quality care that they deserve in a safe manner. Like our long-term care sector, the new law comes as a relief to many of our floor caring for your loved ones. This improvement in condition, along with care and investments in training, are important to making our hospitals the best place for us and our loved ones. I want to thank the workers, hospital leadership, and our legislators, specifically Representative Nose. I also appreciate the leadership of Governor Kotek, who supported workers like me through her career. And I have the pleasure of introducing Allison Sizemore from ONA.
Hello and good afternoon. My name is Allison Seymour, and I'm the secretary for the Oregon Nurses Association, and I serve on the board of directors. I'm also one of the many, many nurses in this state that left the bedside due to the ongoing strain, burnout, moral injury caused from working in unsafe working conditions. My story is tragically not unusual here in Oregon or in any state in this country. For years, nurses and other frontline care providers have faced chronic understaffing in acute care settings, which in turn led to an exodus of caregivers from the bedside. For those of us who did leave, we point to a core cause: unsafe staffing. Not having enough nurses isn't just bad for nurses, it's bad for patients and hospitals. And these issues were at the very heart of what HB 2697 was focused on addressing. I'm grateful to have advocated for the passage of this bill, and I'm thankful to now be one of the many nurses that can return safely to the bedside. ONA wants to extend our deepest gratitude, and I want to extend my heartfelt gratitude to everyone that was involved. To the legislative champions who helped steward this legislation, all of you, and our greatest thanks in particular to Travis Nelson and our colleagues in the House Committee on Behavioral Health Care and Representative Rob Nose, but also Senator Patterson and her colleagues in the Oregon Senate. We also want to thank Governor Kotek for her tireless leadership and her support of nurses, patients across the state, and to our partners in this effort, including our siblings in the labor movement, from the Oregon Federation of Nurses and Health Professionals and SEIU 49. Every one of ONA's more than 16,000 members is proud to stand beside you and in solidarity for the good work that this bill will provide for Oregon. Thank you all, and ONA stands ready to do the work that's going to be necessary to make HB 2697 a success. Thank you very much.
So we're going to sign some bills. So the way we do this is I'll start off with House Bill 2002. So those of you who want to gather up, get close, get tight, because we want to get everybody in the photo. Then we'll do 2697, and then I will take a couple questions from the press here at the end. So everyone, when we're done with the photos, head to the back. So thank you all for being here, and let's do 2002.
2002, come on up. You're perfect where you're at.
So not usually tall. I'm like, oh.
No, you're perfect. Here you go, you go. Here, no, you okay. No, he's be highlighted.
Thank you, everyone. All right, we're going to have a 26.
All right. Oh, go for it.
hear from insurers hoping to delay the program, or with the groups who say it should move forward now?
Well, first of all, Jake, I appreciate the coverage that you've been providing on this. There is strong legislative support to move forward. I do think it's fair to say that there was some understanding during the advisory committee about potential impacts on premiums. I'm confident that we can work through that. And while I understand the concerns, hopefully we can work through that to minimize impact on premiums in the exchange, but also move forward with the plan. I think it's an absolutely critical piece to make sure folks continue to have access to care. And I'll be looking to legislative leaders to help us put that into place after the decisions in the session. So thank you.
Dirk Vanderhart from OPB asks, do you think there is more the state could be doing in advance of extreme temperatures? If so, what?
Well, first of all, my message to Oregonians right now, so many of us right now, including those of us who live in Salem, we had record heat yesterday here in Salem. Please be safe. Go to cooling centers if you don't have a cool enough place to be. Call 211, find out where those cooling centers are. And we are continuing to work. I know the Oregon Health Authority is and will be in the future to make sure air conditioners and other equipment is available. That is part of the new waiver that we have from the federal government on the Oregon Health Plan. It is important for everyone to check in on our neighbors. If you haven't seen someone, check in on them. And as far as future work we can do, I do know the Department of Emergency Management is monitoring the situation, and the state will be there if we have requests from local government to help. Right now, local governments are doing their part. Call 211, get to a cooling station, stay cool, stay hydrated. These are difficult days with the heat.
Just a follow-up to your question. Under what circumstances would you declare a state of emergency?
Currently, I am not aware of any requests from county government or local government to assist. And for emergency declarations, we would wait for that request before responding. And right now, we don't have any of those. I think people have learned at local government, they've learned a lot of things to keep in mind in these situations, and we've learned from tragedy. Right now, they're doing their part, but certainly if we do get that request, I will take it up as urgently as possible. So, yeah.
Governor, where are you in choosing some state executive, particularly a new director of the Oregon Health Authority and Oregon Department of Corrections?
Thank you for the question, Dick. We do have several open searches, including the director of the Oregon Health Authority and Department of Corrections. We are in the process of reviewing applications, and that's the most I can say right now. We have pools of applicants for both jobs, and we are reviewing those and continuing on in the process.
Are you satisfied with the rollout of the heat pumps that was given? Velocity of that rollout?
To be honest, I can't answer the question. I don't know the technicalities of the rollout on the heat pumps. I do know the legislature committed additional resources for heat pumps to move into homes across the state. I think it's an excellent way to address energy costs, but also keep people cool in heat situations. But I don't know. I think it's probably months before a lot of that program is rolled out, but we can get you more information on it. So, last question, Dick.
Governor, last week we asked you about Measure 110, and there continues to be more news about it, both in Oregon and national. What means it? Has your thinking changed at all about what needs to be done? Or is Oregon sort of a victim of bad press?
Well, this is a conversation we've been talking about for a couple of years now. Measure 110 was approved by voters. I believe Oregonians want to make sure that when someone has an addiction, they can get the help they need. Measure 110 is still a work in progress. I want to be very clear about that. I've been clear with the Oregon Health Authority leadership that we need to make sure it works well, that resources are getting out into the community. We were just hearing the other day, there's I mentioned this, I think last week, more facilities in Portland for medical detox, which is important. What I would say is we did pass I signed the legislation to improve the process. I'm going to do everything I can to make sure Measure 110 actually fulfills its promise, which is providing more care and treating this as a healthcare issue and not a public safety issue. That being said, I want to make sure that when people are selling, which is still illegal, that they are being dealt with. I was pleased to see the police work that was done just recently in this past week to collect and go after folks who are selling in Portland, collecting, vast amounts of fentanyl. So we still need that police response to reduce the supply on the streets from dealers. So we can do both, and we have to do both. Thank you, everyone. Good to see you all. Another round of applause for all the great work. Thank you.